If the attempt of sexual intercourse causes your muscles around your vagina to tense up uncontrollably, well, this video is for you. If the same thing happens during pelvic exams or pap smears or with other activities I'm going to describe in this video is for you. I am talking about a condition called vaginismus, guys. I'm Dr. Jen Caudle, practicing family physician. It's good to see you. Now, we're talking about vaginismus. Now, vaginismus is when the muscles around your vagina tense or contract or squeeze uncontrollably in response to something trying to go in your vagina. It can be a penis, it can be a finger, it can be a speculum. These spasms and the squeezing can cause discomfort and pain and actually dysfunction as well. And by the way, this is involuntary, which means you can't control it. It happens on its own. And again, it happens when a penis may be attempting to enter a tampon, a medical device, a speculum, a finger, etc. Now, vaginismus can cause pain during sex, but you can also have pain if your doctor is trying to do an exam on you. And for many people, the pain and the discomfort is so bad, the squeezing, the clamping down, the tightness is so bad that nothing can be put into the vagina, that sexual intercourse cannot occur, that a speculum exam cannot occur. Now, vaginismus is not necessarily something that a woman may have all their life. Sometimes, yes, it can occur the first time a woman attempts intercourse or something like that, but it can also happen, later on in life after a woman has had years of normal sexual functioning or other sort of functioning experiences. The American College of Obstetrics and Gynecologists describes vaginismus as being part of a condition now called genitopelvic pain and penetration disorder. It can happen for a number of reasons. It can happen if you have anxiety or fear around sex or pelvic issues or pelvic exams. It can happen if you've had a bad experience with any of these. It can be related to an infection, a medical condition, a medical procedure. Honestly, in some people, it happens for reasons we don't understand. We don't figure out why it happens. The most important thing that I need you to know is that you do not need to suffer alone. And I have had patients that have seen me for vaginismus as like the first line. They come to me and they say, as a family doctor, this is what's been going on. What do I do? And often I'm sort of involved in getting them to the right people. It's really important because the patients and the women that I've talked to who have this condition, they are stressed out. They are distressed. It is hard for them. It is hard for their partners. It causes shame. It causes embarrassment. It causes fear. There is so much involved in this, which is why I'm doing a specific video on it. I don't want you to feel that way. And there are things that can be done to help you. You are not alone. So first thing is to talk to your doctor, whether you start with your family doctor or internist or you go to your GYN. Certainly as a family doctor, I'm definitely referring my patients to see their GYN. But there are other things as well that your GYN may do and that we may do. Physical therapy can be very, very important and very helpful. Pelvic physical therapy can be great, but also we need to address how you're feeling about this. I'm a firm believer in therapy, whether it's cognitive behavioral therapy, seeing a sex therapist or other therapist. This is very important to deal with the psychological aspect of this. Sometimes medications may be used to help you overcome the difficulties that you're having, whether it's pill medications, whether it's topical medications you put on the vagina. There may be the use of dilators. It's really important to see your doctor because you want to make sure that there is no underlying cause or something underlying that is actually causing this to happen. You don't want there to be a medical condition that is potentially reversible or treatable that could be contributing to this. And one of the only ways we sometimes can know is by seeing your doctor. What we know is that treatments are, the best treatments are often multimodal, which means they often involve a number of different things. And I didn't even mention all the potential treatments. Just know there's a whole sort of toolbox we have to help you. The biggest thing is to not feel shame, to not feel embarrassed. You'd be surprised how many women struggle with this, how many women I've seen over the years struggle with this, and how distressing it can be. So I say this to hopefully reassure you and let you know that seeing your doctor is by and large the right thing to do and the best thing to do. Let me know in the comments what you think of this video, if it was helpful, what your experiences are. Share this video with someone who really might be able to benefit from it. Share it with your partner as well. You're not to be blamed. Remember, this is involuntary. So you're not trying to squeeze or tense up. this is what your body is doing without you trying. I think that's important to say. Anyway, guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. I have another video, if you're watching on YouTube, on painful sex, and I will link that to this video. That may be helpful for you as well. Please subscribe to my YouTube channel. Please follow me on Facebook, Instagram, TikTok, LinkedIn, WhatsApp, etc. Sign up for my free health newsletter at drjencaudle.com. I'll see you soon.